Dr. Meredith Niess saw her patient was scared. Had come to the Veterans Affairs Clinic in Denver with a painful hernia near his stomach. Niess, a primary care resident, knew he needed surgery right away. But another doctor had already ordered a chest X-ray instead. The test results revealed a mass in the man's lung. "This guy is sweating in his seat, and has not thinking about his hernia," Niess said. Has thinking has got cancer. It was 2012, and Niess was upset. Though ordering a chest X-ray in a case like this was considered routine medical practice, Niess understood something her patient didn't. Decades of evidence showed the chest X-ray was unnecessary and the mass was probably a shadow or a cluster of blood vessels. These non-finding findings are so common that doctors have dubbed them incidentalomas. Niess also knew the initial X-ray would trigger more tests and delay the man's surgery further. In fact, a follow-up CT scan showed a clean lung but picked up another suspicious something in the patient's adrenal gland. "My heart just sank," Niess said. "This doesn't feel like medicine." A second CT scan finally cleared her patient for surgery, 6 months after had come for help. Niess wrote about the case in JAMA Internal Medicine as an example of what researchers call a cascade of care, a seemingly unstoppable series of medical tests or procedures. Cascades can begin when a test done for a good reason finds something unexpected. After all, good medicine often requires some sleuthing. The most troubling cascades, though, start like Niess patients, with an unnecessary test, what Ishani Ganguli, a primary care physician who is an assistant professor of medicine at Harvard University, and other researchers, call low-value services or low-value care. A low-value service is a say. Over the past 30 years, doctors and researchers like Ganguli have flagged more than 600 procedures, treatments and services that are unlikely to help patients, tests like MRIs done early for uncomplicated low back pain, prostate cancer screenings for men over 80 and routine vitamin D tests. Research suggests low-value care is costly, with one study estimating that the U.S. healthcare system spends $75 billion to $100 billion annually on these services. Ganguli published a paper in 2019 that found the federal government spent $35 million a year specifically on care after doctors performed EKG heart tests before cataract surgery, an example of low-value care. Medicare was spending 10 times the amount on the Cascades following those EKGs as they were. "That's just one example of one service," said Ganguli. "Cascades of care are common. 99% of doctors reported experiencing one after an incidental finding, according to a survey conducted by Ganguli.